Welcome to Aware and Care, your weekly program with Dr. Ambika Nair, co-founder and chief consultant at Shanti Gram group of companies. As we mentioned, they are having offices here in the tri-state and also online consultations available. In the series of Aware and Care, over the time, we have shared with you many symptoms and conditions of this wonderful body that we have, that we tend to overuse and misuse with bad eating habits or lifestyle habits. Dr. Nair has helped us to understand what these conditions are, what possible remedies are available from the comfort of our home, and of course, which need medical intervention. Today, we will welcome here in the program and talk to her about Carpal syndrome. What does it mean and what this condition is all about? Let's welcome her to the show. Namaskaram, Dr. Nair.
Namaskaram, Madhavi. How are you?
I'm doing very good, Dr. Nair. I don't know, maybe my hand is paining a little. Carpal tunnel syndrome. This is something that we've heard a lot. Mostly professionals are talking about it more often and often. Lots of working days, a simple home life gets disrupted because of this pain. Please explain to us what is carpal tunnel syndrome.
Actually, see, our wrist is made of bones, small bones. That is called carpal.
Mm-hmm.
Because see, the roof of the tunnel, there's a tunnel also. Okay, small passage, that is called a tunnel. Mm-hmm. Made of stiff ligament also. Okay.
Uh-huh.
So through the tunnel pass a number of tendons and cruciality, like the median nerve. That is the one which gives, that feeling to the hands. We feel that our hand is working actually. But sometimes because any inflammation comes, overusing of the hands, in like any pain, any arthritis, there are so many other reasons that I'll be telling. Okay, so like any inflammation, so we won't get that feeling. They will tell I have little tingling, I could not lift even my book. All those things, that's why, especially it is seen with the ladies more, because our hands are, like a little small, our wrist bones and all. So, but in men it is there, but overusing, especially you can see with computer professionals and even, even certain, overusing, continuously if you use anything like that. Okay.
So which part of the hand? Is it the wrist or the elbow or the fingers?
This fingers, like that. Yeah.
Oh, fingers. That's that. Okay. So I'm sure this is a excruciating
the
pain.
Muscles around the thumb also. Some people will tell that, my thumb is not working, because there will be inflammation out there.
Oh, so that gives an explanation to a lot of people who are wearing this little thumb bands and all. So Dr. Nair, you just mentioned that women are more prone to this particular because of the shape of the body and the size. It comes naturally. There's nothing as a specific thing that we are mentioning, but it is about the body type. So off late, are you seeing more and more people complaining about this, or it has always been there, or people are talking more about it now?
No, it develops actually. It takes time to establish. Actually, we all neglect it. See, you get a relief, when you just shake your hands, So this all actually we practice it, so we feel better also.
Oh,
then we just ignore it. Then it really, if you ignore it, inflammation will be more, and you will be suffering.
So it can start from any part of this hand, right? It could be a finger or.
No, it's not. Like even little finger also, even thumb also, even the middle finger also can happen.
So what body types usually you see this, or is it there is age specific, or it is because also for
no, anybody can get into. Yeah, but more vata, kapha, I have seen that. Yeah.
So, but is this also injury related, or it could only because of
causes can be even arthritis, any diabetes, any hypothyroidism.
Okay.
Even perimenopause, even during pregnancy, it can happen. Even some people use a lot of oral contraceptives. That also, like any wrist fractures. Yeah. So there are, like acromegaly.
So Dr. Nair, how does somebody, I mean, of course, you would definitely suggest, and we all recommend that everybody goes to a doctor for a diagnosis. But like we often mention that some terms are very loosely used without proper diagnosis. People say, oh, I have arthritis. Is this completely different, or is the first step, or it's two parallel conditions?
When young people also will come, whether male or female. So we'll see that because they will be like a loss of power actually, paralysis, because the circulation is not there properly. And the nerves cannot supply. That's why, they will tell that I cannot lift anything, I cannot work. So we tell them, because we have to see the history also, whether they had any fall, how it happened, their lifestyle, what they eat, how they sleep, everything, contributes actually.
Okay. So this happens mostly to a hand, which is, or it could happen to any hand. There is no specific reason.
Both hands can come, see any, because actually, like the thumb, index finger and middle finger, I have seen a lot of, even the ring finger, half of that, symptoms can include, difficulty performing any fine motor movements with the affected hand. You cannot do anything with that. Even driving, they will tell that I cannot even drive properly. So much of numbness will be there, tingling can be there, pain, burning sensation will be there, weakness of the hand. So that only they will, even ladies will come and tell, I can't even do anything with the, like making duff.
Okay, so when you say carpal tunnel syndrome, it is always with the hands, right?
Yeah, it is only with the hand. Okay.
Only with the hands. Yeah. Let's get that out to our viewers, that today we're talking about carpal tunnel syndrome. If you have any questions related to that, please continue to key in there, and the team from Shanti Gram will definitely answer your questions. So Dr. Nair, I understand it's a lot of pain. Basic things are not, we will be unable to do it with comfort. What happens if you leave it untreated? We are so much used to painkillers. Okay, it's fine, it's fine. Sometimes people go into years and years of painkillers without getting themselves treated. So what's the worst case scenario? Does the nerve permanently get damaged or anything happens?
Definitely damage will be there. And even I have seen that the previous, like people have gone for surgeries for the, like a carpal tunnel syndrome also, they come with, again, like a numbness, tingling.
So they can have a relapse even after
surgery. So many times I have seen that actually.
Okay. So now let us try to understand what the treatment options are at Shanti Gram. When I come with the pain in my hand so bad that I'm unable to do anything, what happens and how does the treatment
Especially you can see, so many ladies, after 40 to 60 years, they cannot perform, where half nahi kaam karta, that. So they come.
Is it also because of some deficiency, or is it just a
calcium deficiency, vitamin D deficiency? All these things are there, but it all depends upon the case.
Okay, so
yeah, some people, like women, going through menopause or taking so much of estrogen, you understand, smoking. Then if their cholesterol is on the very higher side, and occupational causes are there. Even in the, like a tail aids, you can see the, like anything, like embroidery, doing all those people, I have seen a lot of cases like that. That's what I'm mentioning there.
Okay, sure.
Yeah.
So let's
anybody like painters.
Painters also, yeah.
Okay. I've seen a lot of like painting people. Yeah.
So the more we think about what are the possible situations where it can happen, I mean, anybody from a computer job sitting on a desk job to somebody cooking, somebody just driving constantly, it can happen to anybody. So we're talking about carpal tunnel syndrome, one of the very painful conditions. And off late, it is also being slowly added into a lifestyle disease or condition. Well, I won't talk too much about it because the doctor, the expert is here. She will help us to prevent it first. So doctor, somebody's coming with this pain. What is the treatment options? What options are available at Shanti Gram?
What we do, first of all, diagnosis, that is the Nadi Pariksha. We listen to their history also, whether they are, their hand, like arm in continuous vibration, heavy manual work are there, or working for long periods in the same position or any awkward positions. Like even workers with the meat packing companies and all, packing and all, assembling, even airplane assembling, everything, it will come in that actually. Continuously, automobile workers, even musicians, even guitarists, they used to tell that we cannot do anything like that. Okay, even cooks, electric, any repair work, highway maintenance workers, builders, anybody is there, cutter, anybody, soldiers. So you can find, these people everywhere because it's very common.
Okay.
In any mechanics also. So we see the history, what is their life, like a way of like a lifestyle, what work they do, then how it happened, whether it is any trauma related, then we have to see that, because the numbers, it's very easy because they will be telling you all the history actually.
Sure.
Then we have to do the tongue diagnosis, whether any other contributory factor is there, whether they have any arthritis, whether any constitutional defect. then we do the treatments actually.
So basically, even if you do a little bit of lifestyle change, also it could give a little bit of relief, because when
relief will be there, but for carpal tunnel, you need to do the panchakarma treatment actually, 100% actually, it will help a lot. If it is mild, we start with the, little medication, little exercise, changing positions, all those things, like they can do some pad or anything like that, like any even for the thumb, there are so many splints, small splints are available. This all we will tell them to do it. Okay. Yeah.
So are there any stages in this carpal tunnel syndrome, or is it just one particular state and it just takes care of it by itself? So are there any stages that this is a worst case scenario?
No. That because mild, that's what I told you, mild, but if it is very critical, sometimes it's very difficult also to help them, because very chronic, like, oh, I have this problem for like last 40 years, 35 years. Now, you can't even move, then, they will be aged also. So it will be a little difficult for them, but still we help them.
So doctor, I had a question from one of our viewers as we pick up topics, what our viewers usually suggest. She asked that question that when you go for treatment at Shanti Gram, especially for anything related to your joints, I mean, of course, any treatment process, you have to give complete dedication. Do you put some band-aids that I can't use this hand for next 10 days or 20 days, 30 days? What is that? So they want to understand the basics of the treatment also when something like this happens.
See, Grivavasti is given, and we have we will be putting lepam with the special medications are there. Okay, so that we will mix with this one, like oils, specified oils are there that we have to tie it, and we tell them not that 10 days and all. Every alternate days we do it, okay? Because if needed 10 days also we tell them, but that is very rare. Okay. So that will help them, because even 1 or 2 days, so they will feel the difference. Because I've seen that, like so many people come to me with this. Very, we have a handful of cases even now, lot of cases.
So here are conditions where people are already going with this problem to Dr. Nair and getting themselves treated with some fantastic results. Now, doctor, if somebody is watching this and thinking, you know what, slight pain has just started, I think I have carpal tunnel syndrome. How should I avoid any more further damage, or rather should I get myself diagnosed? Are there any foods that can help to relieve the pain or stop from this happening ever?
Anyway, food is more important in Ayurveda, because what you eat, that is like a medicine for you. Okay, so it's not that overeating, like any constipation is there, any vata related, you understand, whether you're sleeping properly. So many people will tell you, like a burning sensation, like I got up from the sleep. So this all has to be taken care. How have you got it, so this all 100% I'll take care of them. And, without their help, you won't be able to do anything. So I tell them, how much you are going to help, I'm going to help more. So we really take care a lot.
Yeah. So, but if there are any foods just comfort factor from you, so that our viewers can feel very comfortable?
Cold food will never agree with that actually. Cold food.
Okay, cold food.
Nothing cold. The cold will always agree with the pain. Okay. Because in carpal tunnel, because overusing of the hands, we tell them to take rest for a few days. That's more important actually. Maybe like 2-3 days, but in computer tunnel, because they can use their hand like that, in certain positions, we help them a lot. And we give them, what to do. Do's and don'ts are according to the constitution. Carpal tunnel, anybody, even you, me, anybody can get it, because we do a lot of work.
Yeah.
Yeah.
So these are part of the life, and certain changes come because of the body and the age and situations and your work style. But there are possibilities and options available right in your neighborhood, like Shanti Gram group of companies that are helping so many patients with also symptoms and also giving you preventing options where, you can take care of this body. So Dr. Nair, before we just sign off, any final words for the patients who are watching, or somebody who's having slight symptoms?
Turmeric is very good in this, anti-inflammatory. Okay. And even castor oil. They can always use like 1 tablespoon every day at night, 1 teaspoon according to their body weight and all. Okay, it's not like I tell them so that they will be taking like so many things. Okay. Any hormonal imbalance, whether like in menopause, you can see the ladies will be getting that periods are not coming in the proper way and all. So whatever is needed, it has to be taken care. Okay.
Dr. Nair, within the program Aware and Care, every time I have a conversation with you, my mind is just scanning through the entire body like a X-ray and thinking which part of the body is hurting, which question is coming up. But you are always so patient and kind to give us all the information. And that's the best part about Aware and Care. We are creating so much of awareness in the community. Some preventive medicines and options that you provide us for temporary relief are always helpful. And talking about preventive, Dr. Nair, in the coming series, we will be talking about preventive options coming from Ayurveda, how you can prevent from the extreme stage of any kind of condition. With your permission, we will start the series very soon. Thank you so much for today's episode. Your final words for our viewers, please.
Yeah, genetic, like susceptible for neuropathy, because, so these things, if they take care of the children when they are very young itself, this can be prevented. I have said, because, in my case, what happens, they come with the children and then for the consultation. They feel comfortable to bring the kids also when they come.
Okay.
So when I tell, I tell them, if you take care of the child like this, the child will not have any issues, so they like it. Word of mouth is the maximum help, they send me patients.
Sure. Thank you, Dr. Nair. Please like, share, and subscribe to the episodes. As you just heard me mentioning that we will be starting a different series completely here on Aware and Care. You don't want to miss that because health comes first. Thank you, Dr. Nair, for the series Aware and Care.
Thank you so much.